Wellness Cancer Wing at the Regional Hospital, Dr. Mario Catarino Rivas. Project by Listones de Amor, November 2015. Why is this project worthwhile? Located in the heart of the industrial capital of Honduras, the National Hospital, Dr. Mario Catarino Rivas, opened its doors in San Pedro Sula in 1989 and to the general public in 1990. Also called the Metropolitan Hospital, is the largest medical center in Honduras. Named for Dr. Mario Catarino Rivas, who was a prominent physician who devoted his life to the medical profession and promoted humanitarian values in medical care without making distinctions between patients. Currently, the state of the public hospital system in the country is precarious, as demonstrated in the non-existent supply of the most basic medication and medical assistance suffered daily as a way of life by patients visiting the public hospital system. In 2014, only 30% of the basic supply of medicine existed in this regional hospital, confessed by the hospital's authorities at the time, Dr. Juan Carlos Argueta. The situation didn't stop there. It was not only the lack of medication, but the need of basic surgical supplies to execute emergency required surgeries. This scenario was all over the public hospital system in the country, where patients' families were forced to acquire the needed surgical supplies so that their loved ones could be taken care of. Many hold on to hope, yet for others, hope fades when they realize that it's 2015 and the government can't attend to the basic needs of the Honduran people. The unavailability of medicine, supplies, and medical assistance, with appointments far into 2016 and 2017, obligate poor patients to search for this in the private arena, situation they cannot afford. In Honduras, getting ill and being poor is synonymous to death. According to the World Health Organization, cancer is one of the major causes of death around the world. There are currently more than 10 million new cases and 6 million deaths annually. Considered the second and third cause of death around the world, by the year 2030, it's expected to be number one. More than 70% of all of these deaths are produced in countries with low and medium incomes. In our country, where the disposable resources for prevention, diagnosing, and treatments are limited, something similar occurs. In Honduras, the dispersed information in different institutions and the subregistry of statistical data on cancer does not permit an accurate or true picture of the incidence, prevalence, mortality, and survivorship of cancer. In our country, as in most Latin American nations, the number one cancer is cervical uterine cancer, representing 40% of all cancers and 50% of the malignant tumors that afflict the feminine population. Yet, the number one cause of death in Honduras is breast cancer due to its late-stage detection. The World Health Organization has suggested governments consider cancer a public health problem, considered such in Honduras, but not considered a health program priority. Cancer has not been and is not a priority in Honduras' health policy programs and not part of the Millennium Goals set to be met as indicated in the National Strategic Plan for Cancer Prevention and Control 2009-2013 for Honduras. Yet the government recognizes that the mortality rate is greater than the total effect of AIDS, tuberculosis, and malaria diseases of great incidence in the country, and to which a greater amount of the national budget are assigned. According to the information provided by interviews and written data, some of the critical needs facing cancer in the public systems are no or limited chemotherapy medication availability due to no budget allocation, lack of equipment for treating and handling chemotherapy medication, insufficient infrastructure to serve patients, inefficient dispersion of the human resources for prevention, treatment, and cure of the illness, provoking total inadequate, heartbreaking care conditions for cancer patients.
Solo uno que vive las cosas se da cuenta. Entonces, ¿qué le podría decir yo, me entiende? Solo pedirle eso a los gobernantes, de que se pongan la mano en la conciencia y nos surtan de medicamentos en la sala de oncología, que tengan eso, por favor, porque ellos solo piensan tal vez en otras medicinas de otras personas, está bien, pero que se recuerden que en la sala de oncología es bien delicado y que la gente, si no tiene el medicamento, se va. No hay no hay vuelta atrás. Me siento impotente, ya me siento como que ya todo terminó, ya nadie se recuerda de uno, ya todo está terminado. Máxime si no tengo el medicamento en mano ni nada, me siento en el aire. Son medicamentos que cuestan hasta 80,000 pesos cada uno. Y son hasta 6. ¿A dónde uno va? ¿A dónde uno va a agarrar? ¿Cómo uno puede quitarle el pan de cada día a una persona? Uno no puede estar haciendo esas cosas. Entonces uno tiene que resignarse y empezar a beber tecitos y cosas que le dicen a uno y a agarrarse de Dios. Eso es todo.
Although thousands of patients are seen annually at this hospital for different health matters, the total adults attended in 2014 for cancer were 4,951. 50% from Cortez, 14% from Yoro, 10% Santa Barbara, 7% Copan, 4% Atlantida, 2% Ocotepeque, 1% Lampira, 1% Colón, 1% Comayagua, 1% de Valle, 1% Choluteca, and 1% from Guatemala. 79% is feminine population and 21% masculine, similar to 2013. Not only are more than 4,951 adult patients directly affected by the disease, their family members also suffer the destructive effects of cancer. The 5 primary cancers in 2014 at the Catarino Rivas Hospital are as follows. 2014, breast cancer 35%, ovarian cancer 8%, cervical cancer 8%, gastric cancer 6%, colon cancer 4%, an increase from 2013. Out of the 4,900 odd patients attended for cancer, only 1,166 adults had chemotherapies applied in the 2014 and less in 2013. This due to the lack of medication in this hospital. Pediatric cancer and hematology care for children at the Dr. Mario Catarino Rivas Hospital. The outpatient pediatric care program started December 2013 and activities documented as of January 2014. The total outpatient consultations were 6,469 patients, 56% boys and 44% girls. Conclusions. Cancer is a leading cause of death in women and children in Honduras, and the government doesn't have the resources to take care of this crisis. Between these two segments of the population living in the north and western region of the country, seeking help at the regional public hospital Mario Catarino Rivas, thousands of women and children afflicted by this killer disease are left to die. Our project can change these statistics and generate quality of life for patients and families dealing with this disease.